As a clinical commissioning group, we are made up GPs, other health professionals and managers who understand the local health needs of the population and how to meet them. On your behalf, we plan, we buy and we monitor the majority of local health services that people need and use, such as those from hospital or community services.
So, where was the local NHS money spent in 2017-18? As you can see, over half of our spend was used to pay for hospital care and ambulance services. Over £28 million on medication, just over £25 million on supporting people with continuing healthcare needs, £25 million on supporting people who need help with their mental health, £24 million on local GP services, over £20 million on district nursing, health visitors, therapists and some specialist services, £3.9 million on our running costs, £2.3 million on our out-of-hours services and NHS 111, and a further £2.3 million on other services such as costs linked to fertility treatment and diabetes care.
We know for sure that we are stronger together, and this is the key for the future development of health and social care services in Southend. We work closely with our partners and we are constantly working hard to break barriers and team up wherever we can for local people, reducing health inequalities.
It's really important for the council to work jointly with the clinical commissioning group here in Southend, and we've definitely been doing that during the last year. We've been working together on localities, and what localities are about are really how we're going to deliver and remodel our care services and health services around our residents so that they can self-manage their long-term conditions in the community, really think about their own well-being, draw on each other, their family and friends, but also the fantastic services that we all offer here in Southend. It's only through working together, the clinical commissioning group, the council, and with other partners like voluntary sector partners, and involving residents themselves, that we're really going to be able to create a new model of integrated health and care that will really promote well-being.
In 2017-18, we worked closer with Castle Point and Rochford CCG and developed a shared vision across South East Essex. Having spoken with local people and community representatives, they've told us that services need to be more joined up. There are significant challenges that mean that we can't stand still. People are living longer than ever with complex long-term conditions like diabetes and dementia. Nationally, there is a 21% predicted growth in the number of people over the age of 65. £7 out of every £10 spent on health and care services is spent on long-term conditions. To tackle these challenges, we have been working with local partners to shape a new approach to community health and care across South East Essex, i.e. the care and support that is available outside of a hospital building. We want to create local systems of care that we refer to as localities, based around the needs and locations of people rather than boundaries of organisations. We want to bring together all of the resources in the community provided by NHS, social care, community and voluntary groups, with a focus on prevention and joining up services, aiming to reduce distressing trips to hospital at the point of crisis.
We know that all this simply will not happen unless we have a real strong workforce with the right number, right skills, the values and the behaviours to deliver it. We are working with partners to make the local area a very attractive place to live and work, and we hope that by designing better ways of working we will succeed in this goal. We are pleased that local staff recruitment has been successful so far. We know that the word is spreading that we are offering something different and more appealing for staff. In fact, if you know someone who would like to work in local health and care, please get in contact.
In 2017-18, we have continued in our mission to extend the range of local services. We've invested over £1 million in a new community service called Swift to further support people who might need an extra helping hand to stay in their own home rather than going to hospital.
One of the most important things for me about Swift is that it's not about not admitting patients who need to be in hospital, but it's about actually supporting GPs to keep patients at home who are okay and we're comfortable to keep them at home.
We need to look at what technology can bring to the NHS to improve our health and make our lives easier. 2017-18 saw the introduction of technology solutions such as new mobile ECGs in GP practices, an app to support people with COPD, and technology to make counselling appointments as easy as possible. Part of the plan includes giving people more choice of health professionals. Experienced nurses, pharmacists, emergency care practitioners and social workers will help to create more time for GP consultations.
We're not waiting for people to come to us because understand technology is being used to actually look at the information we already have to identify those who are most at risk. So they can be then offered that service. So the service is quite proactive in that regard. So we just don't just wait for people to appear in the system, but actually who's showing signs of some level of frailty, and let's get in touch and see if we can be of help.
A key priority area for the CCG is supporting local GP practices who are witnessing firsthand the rise in demand for care. It is vital that we make GP services in Southend sustainable for future generations.
What I do is I work very closely with the duty doctor for the day. All the home visits come in the morning. My hours are 10 till 6, so I come in at 10 o'clock. We look at all the different home visits, we allocate them. I usually take a fair few, the lion's share, normally about 10 to 12 or even 13 visits, and I pop out and I see everybody. It saves a lot of time for the GP, a lot of time for them, because they can see generally about 6 patients an hour in clinic, but then for a home visit it takes up about a whole hour. So obviously frees up a lot more visits for patients.
GP practices are also working together across each locality to deliver more appointments to local people during evenings, weekends and on bank holidays. However, there will always be times when patients will need to visit a hospital to receive emergency or specialist care. A big part of 2017-18 was about the reconfiguration of local hospital services, which included a public consultation across Mid and South Essex. We would like to thank everyone who took part in this consultation, and we are committed to working with our partners to identify how we can offer local people the best hospital care for their condition.
Our vision is simple: to improve the health and lives of people living in South Essex now and in the future. Developing our localities into joined-up systems of care based around the needs of local people, we will improve the care and support available outside the hospital building to keep people well. And we know that we cannot do it alone. Local people need to play a strong and key role in protecting and managing their own health. Thank you for taking the time to watch this video. I hope you agree that it's clear to see that a huge amount of work has been undertaken by staff and partners during 2017. I would like to end saying a big thank you to everyone who has helped us along the way.